Hello, I'm Dr. Alan Barthen, and I'd like to talk to you about fibromyalgia and chronic pain syndrome. Again, my name is Dr. Alan Barthen. I've been a doctor of chiropractic in Cary, Illinois for over 30 years, and for the last several years I've been studying functional blood chemistry and functional endocrinology and neurology under Dr. Datis Karazian. I'm also studying under Dr. Michael Johnson, the author of the book, What Do You Do When the Medications Don't Work? Dr. Johnson has put together a program where chiropractic, functional medicine, and neurology have been combined to make it work for the patients. And I'm also studying under Dr. Karazian and Apex Energetics, which is a nutritional product and research organization. Now, first of all, what I want to talk to you about is all chronic health conditions have some common threads. Irritable bowel syndrome, Crohn's disease, type 2 diabetes, celiac disorder, insulin resistance, which is metabolic syndrome, a precursor to diabetes, thyroid problems, fibromyalgia, vertigo, sciatica, chronic fatigue, peripheral neuropathy, rheumatoid arthritis, chronic neck and back pains, stenosis, insomnia, infertility, migraine, chronic headaches, and some of the autism spectrum disorders all have some very, very common threads. Those common threads are metabolic disorders, anemias, thyroid dysfunctions, hormonal imbalances, autoimmune attacks, and hidden infections, and on, as well as neurologic imbalances, which means there is decreased firing in the frequency of the brain. And these chronic conditions all have a metabolic component as well as a neurologic component. Your metabolism is nothing more than the way you eat food and how your body takes your food and turns it into the energy that you use every day, okay? Of all the different systems in our body that use energy every day to make our bodies function, one system uses about a third of all the energy that we produce every day, and that is your nervous system, your brain, your spinal cord, and the nerves. If you have a metabolic problem, your brain will not work right because your brain is the most metabolically active organ in your body. Now, it's interesting because your brain controls your metabolism, as it does everything else in your body, but without metabolism, your brain can't function properly. So they are so interwound that the tough part is finding out if it's a metabolic disorder or a neurologic disorder. Most of the time, it's a combination of the two, and you've got to find out why. Now, your nervous system controls, coordinates, regulates all the systems of the body and relates the individual to their environment. All cases are a combination of neurologic and metabolic treatments. About 60% is neurologic and 40% are metabolic. I have seen it the other way around as well. Now, as I said, your brain controls every function in your body. Your brain is a sensory organ and everything is perceived in the brain. With fibromyalgia, the patient's body is full of pain. They have pain everywhere. They hurt here, they hurt there. And interestingly enough, the pain is not actually in the body. It's the pain is perceived in the brain. And the problem is the brain isn't firing properly, so it's giving abnormal signals telling you it's in pain when it's not. Now, you have receptors everywhere in your body telling the brain what's going on. If I'm moving right now, my body is telling my brain what's going on, and my brain's perceiving it and telling the body what to do. So we have many, many receptors everywhere in our system. Muscles, joints, skin, eyes, ears, nose, mouth. I can go on for a long time. Which two inputs light up the brain the most? Touch and gravity. About 90% of your entire body works, about 90% of the energy you use during the day of your brain is your body working against gravity. It takes up a lot of the energy. Chemical and physical stresses to the brain. These are very important. Anemias. Anemias are incredibly important because your brain requires oxygen and activation or exercise and nutrition in order for it to operate. And if you're anemic, you're not going to get enough oxygen to the brain for it to function properly. Blood sugar imbalances, like diabetes, food sensitivities or intolerances, immune system imbalances, poor diets, hypothyroid functions. Some prescription and non-prescription drugs can cause physical stresses and chemical stresses to the brain, as well as chronic inflammation and hidden gut infections. These are metabolic problems that make the nervous system produce imbalances and affect how the brain operates properly. Emotional stresses to the brain, and these are very, very important, especially in this day and age. Your adrenal glands can be under such a load from stress all the time that there could be cortisol imbalances going on, and the cortisol imbalances will affect how your insulin operates in your body, controlling your blood sugars, your triglycerides, your cholesterols, and how you sleep at night. Because if the adrenal glands are not firing properly because they're overly stressed, they'll have your cortisol so badly imbalanced that it'll make you tired through the day, and you'll go to sleep at night, wake up in the morning, and you're still tired because you never did get deep sleep. And this is a very, very serious problem, because if you can't get your sleep, you never do get better. Now, chronic conditions by themselves don't get better. They just don't. When you go to your medical doctor and you've got fibromyalgia, rheumatoid arthritis, thyroid disorders, Crohn's disease, your doctor will give you drugs to suppress the symptoms to make you feel better, but this gives you a false sense of security because you're not resolving anything and you're not stopping the condition. Understand that these conditions get worse. For example, we are seeing a lot of people with fibromyalgia on medication for 20 years of their lives. The condition progresses into other disorders, and guess what? It's usually a very serious neurologic disorder later on in life. Parkinson's and Alzheimer's are the two big ones that we see all the time. All right? So you're getting a false sense of security because the doctor's giving you these drugs, but he's not healing anything. He's faking you out into believing you're better by taking the drugs. If you took those drugs, you know those symptoms are all going to come back, and you don't really do much better, do you? Now, the longer you've got a condition, the longer, the quicker your brain starts to dysfunction. And the McGill University Center for Research on Pain had found that the longer an individual has fibromyalgia, the greater the gray matter loss, with each year of fibromyalgia being the equivalent of 9.5 times the loss in the normal aging process. And in addition, it's estimated that 30 to 60% of the patients diagnosed with fibromyalgia became disabled to the degree they cannot remain gainfully employed, and that is with the myriad of all the medications I was just talking about given to the patient by the doctor. It doesn't cure anything. These people get sicker and sicker and sicker. Now, we do a lot of brain-based therapy in this office, and how is brain-based therapy different from what other people are doing? Well, first of all, it's non-drug. But what we're addressing is a situation called neuroplasticity. When the metabolism in your body is not working right, parts of the brain will not operate properly because it's not getting the energy it needs. And of all the finds in the textbooks is the dawning realization that a brain older than 3 years old is not a rigid structure. It used to be thought that whatever you had by the age of 3, and that's all you were stuck with, and that was it. But they have found out that the brain is more of a plastic organ. And they have discovered the brain continually reorganizes itself, and that's called neuroplasticity. And it means that you create your brain from the input that you get it. You know, the old adage, if you don't use it, you lose it. And that applies to this as well. When you are using those parts of the brain that don't fire properly, and we get those reactivated with fibromyalgia or some of these other chronic conditions, we can get the brain to fire properly again. Again, remember, with fibromyalgia, what you've got is the perception of pain by the brain is inaccurate. The brain's telling you you've got all these pains in your body, and you don't, because your metabolism is messing up the function of the brain. So the key points on neuroplasticity: your brain will change when stimulated, okay? And different types of stimulation help different areas of the brain, all right? A lot of different things we use here to get brains to fire properly. Again, your cerebellum and your brain require two major things to function: fuel and activation, or we can break this down into nutrition, glucose, proper oxygen, and exercise, because those are the three things your brain needs to operate properly, okay? Now, these are some of the therapies we use for brain activation. Upper body ergometers using oxygen concentrators. We have 3 oxygen concentrators here, and a lot of our seniors we put on oxygen to get more oxygen in the brain so the body responds to the stimulation and exercise better, okay? This is what they look like. All right, now the therapies, also more therapies for brain activation, will include vibration therapies, warm water calorics, balance mechanisms, auriculotherapy, advanced muscle retraining, olfactory stimulation, sense of smell. We mix all those with the oxygen therapy and get a much better response for the patient. These are some other ones now: visual and auditory. A lot of times we use different colored lenses and eye exercises to make the brain work better. And you know, in the Department of Auditory Stimulation, Mozart still produces the best frequencies for restimulation of the brain through the ears. Now, how do you know if it's a metabolic disorder causing a brain imbalance? And these are the different things we were talking about before. Proper testing. It's all about the testing. We can guess all we want. We can have the doctors throw drugs at you all you want, but you're not doing anything to fix the problem. You've got to run the right tests. And the doctors won't do that because they'll only run the tests that the insurance companies pay for, okay? There's a lot of good tests out there, but the insurance companies understand are medically oriented. So when we start running tests that are outside the normal medical orientation, they're going to reject this many times. So if you've had a lot of tests run and your doctor says your tests are all normal, then what? Well, guess what? There's another problem. There are lab values and there are functional or optimal values for human beings. Now, the labs take the thousands and thousands of blood tests that come in and they make a bell curve average. And what that bell curve average does is it determines where everybody is at as far as normal. And they consider normal where everybody is in the bell curve, not what's actually optimal for human beings. So there's the functional range and then there's the lab ranges. Your medical doctor is using the lab range that the lab tells him is normal. The problem is when you go from lab to lab throughout the United States, no two labs agree on what the normal range is supposed to be. So we stay with the optimal ranges for human beings, or functional, because those are much closer to being exact. It's still a range, it's not just one number, but we get a much better value and much better function from functional values versus lab values. All right. So this is what it looks like. You've got functional lab ranges and then you've got abnormal ranges. And the functional or optimal ranges are better for human beings. Now, metabolic treatments. The one major reason we are getting chronic patients better is we are simply running the necessary tests to diagnose a patient appropriately. This is vastly different from what your PPOs and HMO models are doing. Okay, and how long have you been going to the PPOs or the HMOs or Medicare for that matter? And you're still suffering. I have people come here all the time with Medicare, and they say, well, Medicare pays for all my care. Well, good for you, but are you getting any better? Medicare is paying for care that doesn't work. That's lovely. All right, you need to understand that some of this is going to come out of your pockets. Let's grow up and be responsible for our health, people. The insurances are not going to cover all this stuff. All right? Now, based on the history, we may run any of the following tests and look at functional values. Complete blood chem panels, salivary hormone testing, stool ecology profiles, and we will also run a number of tests from a company called Cyrix Labs. This is truly probably the best food sensitivity lab in the United States. And they also have tests specific for leaky gut syndrome and autoimmune testing. We can actually find out what foods are attacking the inside of your body and how your body has become autoimmune and what organs in your body are being attacked by the autoimmunity. And the Cyrix Labs gives us those answers. All very important. Once we have the answers, we can test properly. You've got to understand that it's like a great big pie, and you've got all these different pieces, and we have to put all these pieces together to make a whole person again. So, not many of you probably have had all the tests performed that I've just talked about. And if you have had some of those tests performed, they've probably read them the wrong way because they're using lab values versus functional or optimal values. It's that important. So what's next? If you come to my office and you want to talk to me and have an examination for fibromyalgia, this is what we do. On your first visit, we will do a complete, and I mean complete, neurologic examination. We will review existing labs if you bring them in for us. And we have a number of metabolic forms that you need to fill out and neurologic assessment forms. These are incredibly important, and I expect a spouse or a significant other to be with you. Then we will have you come back on your second visit, and we will give you a complete report of findings. Your case, we will review your case, and the overview of complete further testing will be done. We will review the neurologic findings from the first visit and the overall view of the treatment plan, financial obligations, and again, the spouse is expected to be with. All right, now I only accept about 5 new fibromyalgia patients per month. They take a lot of time. And these exams, as long as they are, and sometimes they'll include x-rays, can be as high as $450. But what I'm going to ask you to do is come in and pay $50 on this, because I want you to see what this is like without spending a lot of money up front. But there's 3 rules for acceptance. You must be willing to make serious life changes, and I mean that. You have to take accountability for your health. Insurances and Medicares only pay for a small amount of this, so you need to be prepared to pay a few dollars a month out of your own pocket. So on a scale of 1 to 10, how serious is your illness? How is it affecting your relationships and your work and your ability to enjoy your life? I bet you're not enjoying life very much. You're probably walking dead half the time. And on a scale of 1 to 10, how serious are you about eliminating this? I can only accept patients that are truly interested in getting themselves better. All right, my name is Dr. Alan Barthen. My number is 847-639-0010. I hope you give us a call. Thank you. Have a nice day.